Right. Thank you so much, everybody. And we have actually, oh, well done. Thank you so much. Thank you so much for being here today at our NAFEA webinar around our grants, update about our grants, and update some research that NAFEA has actually been doing. Now, before we do commence, my name's Anne McLeod. I am the president of NAFEA, and it's a real honour and very humbled to be here today. And I would like to actually acknowledge the traditional custodians on all the lands on which we are seated at the moment, because the land has always been theirs and always will be theirs. And the learning and the understanding and the guidance that we can have from our First Nations peoples is just so important in how we work with our work integrated learning and how we actually engage with one another as part of community. And please, so I'm actually on Wiradjuri land, one of the largest First Nations nations that we have here, that actually is also then broken up into eight tribes here in Wiradjuri. Please feel free to put your nation that you're on in the chat. That'd be fantastic. As we move in today, we were actually going to do a bit of a summary and an update of what's happening in one of our research projects. And then we will actually be talking about how people can actually apply for research grants. They're going to be released soon for applications, so it's very exciting. NAFEA is very committed to supporting the work integrated learning space in a variety of professions. And so I really just appreciate each and every one of you coming here today to hear about that and to talk through that. If you've got any questions, I will keep an eye on the chat to begin with, whilst Elise commences our presentation. So we'll most probably do the presentation. Any Q&As throughout that, we will have some time to pause and to ask some questions, and then we'll go straight into our discussion around the grant process and application process. Ricky, is there anything that I've missed, Vice President and Admin Guru?
No, I don't think so.
Thank you so much. Thank you so much. Fantastic. So, Elise, over to you. But just before you go, sorry, can I just actually ask people, most of you have done it already, can you just put yourselves on mute just so that we can hear everybody? That'd be great. But I love seeing everybody's faces. So the more faces I get to see, that's awesome. Thanks.
Thank you, Anne, for that welcome, and thank you all for taking time out of your really busy days, or busy day, I should say, today, to spend some time with us. Obviously, this is a hot topic, and the costs in work integrated learning, costs in general, as we do face budget pressures at the moment. So, look, welcome. This research project funded by NAFEA is investigating what are the costs of work integrated learning for education providers, and that's in education and in health disciplines. And I'll get started. I will start by also acknowledging the country that I am coming from today, which is the Yugambeh and Kulin peoples, and acknowledging that they are the traditional custodians of the land. And I pay my respect to the elders past and present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples. I'll get started with a who is our project team and leading in this work. So we've thank you, Anne.
Are you supposed to be sharing a screen?
I am. Is it not coming through for you?
No, but it might be coming through for other people. So everybody else can see it. It's just me. Don't worry. Thank you.
I can see the PowerPoint, Elise.
You can? Okay,
sorry.
Perfect.
It's just me. Sorry.
Sorry, Anne. So look, our project team, and I want to, obviously the list is there and I'll go through that, but I had a chat to everybody this morning, or most people this morning, and combined we have over 80 years of experience in work integrated learning across health and education. Our project team come from all states, or the majority of states in Australia, and that is where our project needs to be, is we really do want to understand fees and costs of work integrated learning across Australia. So Dr. Anne McLeod, co-lead investigator, myself from Griffith University, Dr. Ricky Tunney, Sarah Dahl, Dr. Judith Needham, Sharon Crawford, Ben Archer and Tessa Knights as our project team. This research project, and as when we think about costs of work integrated learning, costs of placements, it took us some time to really break that down into what the scope would be. We really wanted to, and the purpose of this research project is to identify that enablers, the barriers and the impacts on our higher education providers on paying for work integrated learning. There is a focus, and we did have to narrow our focus despite our wants to go broader. We did narrow that focus on education and health in Australia. The project does include investigating costs, both financial and in kind. So not just focusing on one area in particular, because we know that those in-kind costs add up. And probably more acutely at the moment, we're very aware where those costs come in and where we're asked to look at, how we're spending our money internally. Look, what we will not be looking at is our costs on industry partners, the cost to our students, and some other areas there. While this is really important work, it was hard enough to get and design a survey that investigated the costs that we are looking at, but it does open the doorway to further research and further projects for sure. Something else that it doesn't look into is that impact. So cost and the impact on quality experiences is something that we're not looking at in this survey. A little bit of a breakdown into our project design. There is obviously going to be the data collection, of which we've got a survey coming out to you by the end of the week through Qualtrics. There will also be some interviews, and you will be asked on the survey whether you would be happy to be interviewed. So really, this is a call to action. We don't have the data. We don't have really good solid data, which Ricky will talk to shortly. So we do ask that you complete the survey so that we all collectively have this information to work with moving forward. There'll then be some data analysis and obviously some surveys as mentioned, and interviews in that process as well. I'm then going to hand over to Ricky for a quick literature review overview. Over to you, Ricky. Thanks,
Elise, and welcome everyone. As Elise mentioned, there's not a lot within the literature. We did start off with about over 2,000 pieces of literature that we had identified using some specific terms in some of the library databases. So that brought up over 2,000 records. From that process, we then, looking at the abstracts and the titles of the publications, we then excluded a certain number of publications because they didn't meet the scope of the particular focus of this project, which brought us then to 16 publications, which then went to a full review. So we reviewed all 16. Could I at least get you just to go to the next slide, please? So those 16 publications, we went through all of them, and 10 of those were deemed to be included, would be included in the literature review. And those 10 can be roughly summarised across a few different themes. The first theme is around sort of the cost and the resourcing of will. There's a publication that talks, Hoskin and others, where they're looking at the introduction of payment in social work in particular. And that led to a rotational model being trialled in social work. There was another publication that looked at ICT and particularly looking at in-kind contributions and the resource intensiveness in managing those kinds of courses in the will space. And the second theme, a sub-theme of that overall theme is around cost analysis. So there were a couple of studies that looked at the costs associated with. One was related to rural placements and looking at the cost of rural placements at James Cook University. Their conclusion was that while the cost was $32,560 for a rural placement, that cost, the benefits of that outweighed all of the costs. Fu and others have looked at the comparison between student clinics and placements, and they also included some discussion around the Victorian placement fee costs as well. Now, the next theme, if you want to just skip to the next one, is around economic and cost effectiveness. So there's been some frameworks that have been developed and some analysis of the economic costs associated with students, and Fu again has looked at the costs of students failing within clinical education. So when students fail a placement unit, what cost is that to the university? And then a few others have looked at funding and the cost effectiveness of will. So one particular publication, IMS et al., their conclusion was basically that the increase in placement fees led to universities doing more simulation to try and reduce the costs on placement to them. So some universities have, if it's within their accreditation standards, have been able to move some of the external placement activity to internal and using simulation to fill that gap. And then the other publication there listed there by Seagull is around the estimation of clinical training costs per health discipline. And the final theme is related to, if you want to just go to the next slide, Elise, it was a couple of case studies. So there was one that's related to early childhood teacher education and another one looking at midwifery education and particularly the escalating costs and reliance on simulation. So there's a bit of a theme going on with some of the publications where increases in placement costs means that the universities start looking for alternative ways to deliver work integrated learning, and simulation seems to be the fallback in some of those cases. The final slide is, I just wanted to go over, was really where most of our information is coming from is through the grey literature. So government reports, and Ben Archer, who's online today, he has been our RA for this project. He's been able to gather some of this information about the different costs associated across different states and different disciplines. There's a lot that either doesn't get disclosed publicly or is negotiated on a one-to-one basis. Victoria, I think, and education are probably the only ones where there's a little bit more transparency. Queensland nursing, there's a little bit more transparency now where they've got set fees. But generally speaking, there's not a lot of transparency around the actual fees that are being charged. So a lot of our research is going to be really looking at the information that gets submitted through the survey that we'll be distributing after this seminar. So we really are looking for our members to contribute to that information so that we can pull together a more holistic picture of the costs associated with work integrated learning for education and health disciplines. And I'll hand back to Elise now.
Thank you, Ricky. Before I change to the next slide, I'm really interested to know, we've got 38 people here with us today. by a raising of hands in our Teams chat. Can I see who is coming to us from any health discipline?
Eleven. Wow. Oh, 13.
13, 14, 15,
15.
Okay.
16, 17.
17. Oh, wow. 16. Yes.
All right. So if we put hands down, can we see who's coming to us from education? That's great.
That's it.
And we might have others from other areas. If we put hands down, have we got anybody outside of health and outside of education?
We have some
Cool.
professional staff as well.
Amazing. Yeah, I don't discriminate professional and academic.
No.
So 100%, but yeah, absolutely.
Exactly.
And that's great. So look, a massive welcome, and obviously, thank you all again for taking your time out, and we can see that the impact here is enough for you to take the time to come here to understand what we're doing today. I'm going to jump into the next slide, and we might do a little bit more of that. It's really nice to see the impacts on what you're doing as we get ready to send out this survey. So to give you a bit more information into how we're gathering this information, and thank you, Ricky, for providing some more info there. But we're really looking at not only collecting the information around how much it's costing and how we can break that down, we're also looking at costs and benefits, and whether we've also then seen some impacts from that as well. So in identifying placement costs and whether there is a benefit, we're looking at the total expenses incurred. So that is going across different sectors, and we're trying to look at some breakdown there of whether your placements are in public sector, private sector, NGO, and then where the costs come into play in those different areas. Because as I know from the disciplines that I'm across, one discipline area might be across every one of those provider types, and the fees for every one of those provider types can vary quite vastly, in fact. So this survey is designed that you will be able to go into the survey and complete it for each one of your discipline areas and provide all of this information for that discipline area. So if you're across a few discipline areas, that you will get the opportunity to submit more surveys to allow for that information to come through. By the show of hands, can I see who is actually paying for placement fees directly to an industry partner? So that would be the negotiated payment arrangements. Fabulous. So yeah, 18, and we're still going up. So we know that it's definitely, and thank you, you can pop your hands down. For everybody here, or for the vast majority of us, there is some payment of fees directly to an industry partner. There are also in-kind contributions, those non-monetary benefits that we're trying to capture in this as well. We also are very aware of the staff that are needing to be provided. So I know here at Griffith, which is where I'm coming from, we have a full unit or area that looks after our student compliance requirements. So that cost is huge and is absorbed by the provider in order to provide work integrated learning to our students. We're also asking questions such as, are there costs for cancellations? So where we know we're paying directly for a placement, do you also incur a cost when you cancel? Because as we're very well aware, work integrated learning is not neat. It doesn't fit into a lovely, neat little box where you organise a placement and you send a student goes and does everything as per the timeline, and they're never unwell, and the supervisor's always there and never changes, and then it finishes and all hunky-dory. It's almost the complete opposite. There are always going to be issues. We hear of breakdowns, and it doesn't seem to matter how well we plan, these things just happen. So that's some more information that we are gathering is around the cancellations and whether we're still being charged for those costs of cancellations. We're also requesting any information or any suggestions that you have around improvements to placement costing models. So while we want to know the impacts and we want to understand the breakdowns of costs, because that is information that I think will help a lot of people as we place students in some programs nationally. We're looking at how much it costs here in Queensland for us, and then actually in WA we have to pay there. That's what's that's the standard, that's norm over there. So for us, it's really about gathering all of that information in one place so that we have a starting point. So getting your feedback, getting your information, and then also having the ability for you to let us know if you're happy to have a interview with us is really helpful and will help us to gather as much information as we possibly can through this NAFEA-funded project. As we go through this, I'm interested to get your feedback on, we're asking, and thinking, right, fees, have we got it all? Are we getting fees from, providers? Are we getting the in-kind contributions, the staffing costs across different sectors? Does this resonate with you? Is this what you're thinking? Is that this information that you're also interested in understanding? And, is that obviously while you're here, but are there things there that you think we're missing, or things there that you would really super interested to understand and get this research information on? So I'm sort of throwing it out there at the moment for a Q&A.
I guess, Elise, we were trying to gather a little bit more transparency around the costs associated with work integrated learning for education providers. So I guess that was kind of the motivation, wasn't it? It was around that transparency, which there's quite a bit of lacking in certain districts, jurisdictions at least.
Yeah, absolutely, Ricky. It most certainly was. And even as a project team discussing between health and education and understanding the differences there, we found it to be quite different, and some areas known, some not, but even within health. We know of in-kind contributions that might have been a bright, shiny building that was built. And, there are lots of different ways that we as universities have been paying for placements over the years and different agreements.
And quite often those particularly in-kind costs are quite often hidden costs as part of this whole equation as well.
Absolutely.
Is there anybody else that has any comments in regards to this space about the payments and what we're looking at here? Just opening up for some discussion. Put your hand up if I can't see you, or just call out.
Hi,
Please.
I think the other considerations, particularly in education, is around what that payment is for. So historically in Victoria and pretty much in schools, that payment is paid to the school, who then pays that to the mentor teacher for supervising the student. So that's obviously quite common. I'm not sure what happens in other states, but that's in Victoria. In early childhood, where the union doesn't stipulate that amount that's being paid, but we honour the same amount being paid, is that some placement providers, organisations, don't pass that on to their employees or the mentors and keep it maybe for PD or something like that across the organisation. So there's a vast difference, I think, in terms of who's getting that money and what it's being used for as well in those fees. So in health, it's generally that you're paying the organisation. It might be a tripartite arrangement, but you know that what the university pays, the hospital is obviously providing supervision, and then the government is also funding part of that. But that's sort of quite different in the education space. So I think that's something else for consideration there of who's getting that money.
That's great. Thank you, Liz. And yeah, and as you mentioned, you know in Victoria, I think you mentioned, but you don't know everywhere else, and it is really interesting to gather and get that transparency across different states as well, of how it's happening there. But thank you so much.
That's quite an interesting topic because, quite often, because as Liz says, in health disciplines, generally the money just goes to the organisation and the actual supervisors don't see any of that money. And anecdotally over the years, I've heard supervisors talking about this, and we I wonder whether there would be more incentive in the health space if that money went directly, although it's usually and I'm thinking in the nursing space and particularly in Queensland, where that money really is covering the costs of the person's salary so that they can be taken off ward to supervise. But if there was some kinds of incentive that went directly to the supervisor, would there be a better experience for the student? Would there be more people willing to take up those supervisory roles? So I think that is definitely an interesting thing to try and unpack.
And further to that, Ricky, maybe also more interest in upskilling their own supervision capability as well, and not view that as an impost or an additional burden.
That's very true.
Definitely.
There was somebody else that had their hand up a moment ago. It went back down again. So I'm just trying to figure out. Oh, Suzanne.
Hi, yeah, I was just going to say,
Suzanne.
I really welcome this project, and it's something. So I'm from University of Sydney, and it's something that we've been doing a lot of work and analysis on ourselves, and I think, there is just such a lack of transparency and different models and options going around. And at my university, we've very much steered away of a purely transactional fee per placement type of model. And we've gone more down the sort of, investment in research, conjoint positions, infrastructure, etc. But then we've lost out on placements where another education provider said, we'll give you $30 a day for that placement. So it's just not a level playing field. And there's real worry about entering into these individual payment arrangements with the providers, because then they could shop around and say, well, actually, this university's offered me $40 a day. And we're like, oh, okay, $45 from us. And it gets into this bidding war. So I would really welcome like a more transparent, even if it ended up costing us more, it would be a more level playing field. And it would make, for my team of professional staff, it would make sourcing some of these placements just a lot less of a white knuckle ride, I feel, because it can be really stressful, especially in the allied health disciplines. It's always, we always get the students graduated, but it's a lot more stressful than it needs to be.
It's those cold calling, Suzanne, also, and trying to see who has that better deal, and that's why this research is just so important to actually facilitate the discussion. And I think it's even, as you pointed out, that white knuckle ride. I think that what we're looking at also is the new norms that we are going to be seeing now after our post-pandemic situation as well. Now that, and whether or not the idea of sim and simulation for our placements may be more cost beneficial. So that's all part of this discussion as well. But, answering those questions, I look forward to, you sharing the survey around your colleagues in this space. Does anybody else have any comments around this process that we've been discussing? Just mindful of the time as well. Elise, did you want to continue?
That's about it from me. So I do just have some references there. Yeah, I just wanted to wrap up by thanking you all again for your interest in this, and really to say the survey is coming out. It's coming out in the next few days. We're hoping by the end of the week. And look, if you can spread that as far and wide as you can, and help us to complete that survey, that will really give us some more insight and information, which is what this is designed to do. It is around the transparency. It's around giving everybody here more information, so that we can utilise that together.
And the survey won't be asking you which university that you're from, so there will be some anonymity around the survey. It will just ask you what state that you're based in, so we can then collate and look at each state and sort of average costs across the state. We felt that there might be some reluctance for people to actually put in their university and start talking about so they could be particularly identified. So we wanted to have some anonymous aspects to it.
Can I just make mention of that also with anonymity? So that fails 3 times. It has gone through a rigorous ethics process. So if you're part of a university that is concerned around that, the ethics has been and will be cited down there, has gone through HERIC, so that there is that cross-checking, and that the research that we have from here, we will be actually publishing from. And I think that's really important, that we're not just going to sit on this information. It will be published out further, and that's a really exciting thing for NAFEA to have that as a bespoke research capacity. But so thank you so much, Elise, for sharing our vision and our work there, and Ricky, thank you so much for unpacking our lit review that we've got going along in that process.